for something. That something is not a privilege. It is a procedural justice. It is professional dignity. Now, as you may recall, as a fellow of a profession and a steward of its future, I feel compelled, very compelled, to ensure that these voices are not only heard, but acted upon. They are not going to be assisted because of sentiment, but because it is our duty. Our duty to the values that we hold sacred as pharmacists. So our calling demands that we not only produce competent pharmacists, but we have to protect their transition into service. We are not the ones to become a barrier to our students. Because already pharmacists, as we know it, have already enough problems, enough impediments out there in the real world. So to the BPharm 5 class, you are not merely students, you are emerging professionals. Your voice today honors the profession you are about to join. Let this be a turning point, not only for you, but for how we handle each other, one another as colleagues, and how our systems respond. And this should be a case study for us as pharmacists. How do we handle our esteemed colleagues? This is very dear to me. Second, let me just acknowledge with gratitude some of the scholars who shaped my journey also at the University of Nairobi. I am a double product of the University of Nairobi. Professor Shita Almaru, she spoke a few minutes ago. Professor Kuria, Guantai, Kibwage, Oluka, Maitai, Okalebo, all, name them. And doctors Eric Guantai, topping the list, Lucy Thirop, Karimi Nyamwe, among others. So then let us keep this in perspective. Even as we record history, let it be written this way. I was the founding chair of the Bachelor of Pharmacy program at Kisii University. In fact, when it came to building BPharm program in Kisii, I looked for people who are serious, colleagues who are serious, respected seniors who are serious. So we formed a strong team comprising of Professor Kibwage as chair. He was then DVC at Egerton. He was also the chair of the MBCHB development program at Kisii University 2014 to 2019. Now we had other members, Professor Abuga, Dr. Ngarora, and pharmacotherapy specialist, Professor Ndemo, then of USIU. So today, I stand here not only as a proud alumnus, but as someone who has drawn from the University of Nairobi well to build for the future, especially for Southwestern Kenya, which was underserved in terms of pharmacy training. So our accolades to the University of Nairobi. Finally, it is now my very humble pleasure and privilege to welcome you to session 3 of this landmark Pharmacy at 50 Symposium. This session reflects on a theme that resonates deeply with many of us: the impact of University of Nairobi pharmacists, that is the alumni, in government and industry. So as we mark 50 years of pharmacy education at the University of Nairobi, we take pride in how far we've come, not just as individuals, but as a profession collectively. So I won't do a personal reflection now because I've already said, but suffices to say, when I graduated in 1985, I was sent to a remote government facility with minimal infrastructure, little recognition. But then when I went there, I carried the vision of our pharmacist, not just as a dispenser, but as Professor Kokwara would say, as a systems leader, a regulator, an innovator, a policy advisor. And for your information, I've been through most of them. That vision has taken root. And today, we can confidently say that UoN pharmacy alumni are shaping both government and industry. So I'll this afternoon like to welcome the panel of distinguished professionals whose work has impacted so many lives in government, especially as setting policy. So we'll have two host panels. The first panel will explore the impact of UoN-trained pharmacists in government, both at national and county level. And I'm happy some of my very successful interns are with us here. And I just want to check, is Dr. Rebecca Musyoki on this call now? Are you in the meeting? Well, Dr. Rebecca Musyoki does not appear to be in the meeting. Now, I don't have any fallback position. So what I will do, I will straight away invite the vice presenter because then we can't wait forever. Dr. Rebecca Musyoki, are you there?
Yes, I'm on site. I'll be able to take it up from here.
Okay, just a moment. I'll give you the chance then. Let me just introduce you. The first session will be moderated by Dr. Rebecca Musyoki of Nairobi County, and it will look at the impact of UoN pharmacy alumni in government, both national and county levels. And the second one will deal with the Kenya's local pharmaceutical industry, where pharmacies are driving growth, innovation, and competitiveness. That panel will be moderated by Dr. Sarah Vugigi of Kabarak University. She was my classmate. I believe she's around. So, ladies and gentlemen, esteemed colleagues, respected seniors, please join me in welcoming our speakers with warm appreciation. If you can clap wherever you are, if you are in the physical hall, please clap your hands and welcome Dr. Rebecca Musyoki to lead us into the first panel discussion. Thank you all very much. Dr. we are all yours. Rebecca.
Thank you, fellow Dr. Roberts. Yeah, I think we can start. Good afternoon, everyone. My name is Dr. Rebecca Musyoki, and I'll be joining you from the Nairobi City County Government. I'm an alumni. I graduated in the year 2012. I'm happy to see one of my classmates here, Dr. Kagia. We were in the same class. But besides that, I'm happy to see the people who made us, the teachers who shaped our journey, Prof. Okalebo. I'm able to see also Prof. Guantai and so many others that I may not be able to mention. So what do I do at the Nairobi City County Government? Yes, I'm a pharmacist, but I'm one of those pharmacists who followed Kokwaro's path. So I'm also, apart from teaching me in the School of Pharmacy, he has taught me at the School of Strathmore Business School, where I did health management. So my master's is in health management, and currently I'm leading health financing in the county, one of the most important building blocks of the health system. So that is what I do. And today I'm going to lead a very important conversation about all of us who are in the government and the tremendous good work that we are doing. So I'm very honored to moderate this vital discussion today, and allow me to just make the opening remarks. For half a century, the University of Nairobi Faculty of Health Sciences has been and the School of Pharmacy to be specific, has been a cornerstone in training pharmacy professionals in Kenya. Today, we want to turn our focus to the profound legacy these graduates have built within the corridors of government and public service. Their impact is far-reaching and transformational. And we are talking about driving pharmaceutical policy reforms to strengthening health systems and advancing access to quality and quality essential medicines. So today, why are we here in this afternoon? We are here to spotlight these critical contributions and celebrate the remarkable leadership journeys of the UoN alumni. At this point, please join me in welcoming our lead speaker for this session, and this is Dr. Evelyn Wesangula, who will share insight into the historical contributions of UoN pharmacy alumni and their journey. Dr. Wesangula has been one of those champions who's managed to make something that was just started as a conversation. We were just talking about AMR in classrooms and all, but she's managed to make it a national agenda, a national conversation. So today we want to hear, how has the journey been like? Has it been easy? And we're going to give her 5 minutes to walk her on her journey, and not just on AR. We know that she's held critical positions in public service, and she's here to share her journey. Welcome, Dr. Evelyn Wesangula.
Thank you, Doc. Allow me to share my screen. And as I do that this afternoon, I know it's not easy to talk about a journey that has taken maybe 20 years in 5 minutes. But I hope I'll be able to do justice and share quick highlights. And I just want to resonate with what Dr. Atebe said. I think I really echo his sentiments that, yes, we have a responsibility to make the future of the current student pharmacists better. It all depends on how we usher them into the profession and what we do while we are in the profession. So I currently work with the East Central and Southern Africa Health Community. This is an intergovernmental health organization that is based in Arusha, Tanzania. We serve about 9 member states, but our work cuts across 24 countries in the sub-Saharan region. And I moved to EXA after about 20 years of service with the Ministry of Health. When I looked at the data I first reported to the Ministry of Health, I realized I've done about actually 22, I'll be doing 22 years with the Ministry of Health or with the government of Kenya or in public service. So I have a few goals for my session today, just to give us a better understanding of AMR, the threat and the policy landscape, and the place of evidence-based policy, advocacy and action, and how that is really, really important in trying to position a narrative and also gain traction in terms of support. And the place of sustained leadership, political visibility and commitment. And as you grow in your pharmacy journeys, I think our journeys take us to different places. And you get to places where politics cannot be separated from the conversations that we have. And the place of sustaining leadership is so critical when it comes to making sure that there is commitment to a certain agenda. Of course, I'm talking about MR because it's now a global challenge. And of course, being pharmacist, and I always say this to every pharmacist that I meet, that there is no one who is better placed to address antimicrobial resistance when it comes to professional backgrounds than a pharmacist. So wherever you are, it doesn't matter whether you're in a hospital setting or you're in public health or you're in industry or in community. It just comes naturally that we take charge of this particular agenda. Looking at the number of deaths that we are recording or we are seeing from data that is being generated, the one that is in red is sub-Saharan deaths, and the one that's in a red square, 200,764 deaths due to sepsis. These are Kenyan statistics. About 30,000 deaths due to resistance. These are Kenyan statistics. So of course, looking at the contribution you are making globally, I think the impact is huge. And apart from just looking at the health component, we also take antimicrobial resistance from what we call a One Health approach, looking at the impact in the environment, the impact in the agricultural sector as well, And apart from just causing deaths that you can count, there is a big aspect of driving more people into poverty. And the World Bank report says that about 28 million people can actually be driven into poverty due to loss of productivity and livelihoods. And as I say this, you can just begin to look at the costs of maybe second line or third line treatments compared to your first line choices of antimicrobial agents. So where did this journey begin? And as Dr. Atebe spoke, I just felt like, did he have a look at my presentation? And I think my journey began with my first posting in 2004. I was posted to Malindi District Hospital. I was the first pharmacist in the hospital and the first pharmacist in the district. So that gives you double responsibility to handle the hospital and to handle the district. And I think at this point, I made my decision to stay in service when I looked at the need that was there and the need for people who are going to drive change within a sector. I had an option to go into private sector, but I actually declined a very good package because I felt the need to provide service was actually greater than the need to stay in the private sector. So I stayed on and I grew my leadership skills and I started my public health journey, running an HIV clinic there, improving the pharmacy infrastructure. And from that point, I moved to Nairobi province. Then in 2006, got bigger exposure to public health programs at a national level. And for a short period, I was actually holding the position of the provincial pharmacist. Yes, I was young, but I had a lot of passion and a lot of drive for public health. So in 2009, I ended up going to do my master's at UNITI, the University of Nairobi Institute of Tropical and Infectious Diseases. This was a very unconventional path. And when I say this, I remember when I went to get clearance for study leave and sponsorship, I was told that this is not a pharmacy-related course. We were two pharmacists who had applied for study leave and we were denied one, sponsorship, and number two, we could not get study leave very easy because it was not a conventional pharmacy course. But the two of us pressed on and eventually we were given study leave, but we had to pay for our postgraduate studies because this is what we felt resonated with our passion. And once I finished my master's, I was sent to New Nyanza, that's the Jaramogi Oginga Odinga Hospital right now. And at this point, I thought I had been posted to a wrong place because I felt I belonged to a program. And when I got into the hospital, it took me about 4 months to try and find my footing. And one morning I walked to the chief executive officer at the hospital and I told Dr. Julia, I think I can do something else, not what maybe the chief pharmacist thought I could do. And she told me, go and write your job description. So I went and wrote my job description based on what I felt I needed to do and what I could do from the hospital from my observation over the 3 months I'd been there. And it's at that point as I started working on establishing infection prevention and control committees and antibiotic use protocols within the hospital. I didn't know much about antibiotics, AMR at that point and programs and things like that. But this was an important turning point for me because this is what set the stage for what happened later on. And once I moved from the Jaramogi hospital, the New Nyanza hospital, then I moved with that passion. And I remember going into MSH and asking Dr. Kusu, do you have money to support this? When I was still in Jaramogi, we didn't have money, but we read and we tried to put a few things in place. And when I moved to KMTC, for about 3 years, I was teaching there at the pharmacy department. I got an opportunity to coordinate a multisectoral team, the Global Antimicrobial Resistance Partnership, that exposed me to the situation analysis for Kenya. And I took this to the Ministry of Health, and they gave me a place within the National Infection Prevention and Control Technical Working Group. And through the contribution of my membership, they made a resolution to establish a national program. And when this was done, there was no better person to move into establishing the program than was sitting and pushing this agenda within IPC. And in 2015, the MOH actually appointed me to be a national focal point for MR and allowed me to begin to establish a multisectoral program for MR. And as I say now, the rest is history. I took effort to build my capacity through different public health fellowships at the Chatham House and also the Fleming Fund Fellowship, and that helped me to really take advantage of the opportunities that came within the country to further build the program. And you can see it took us about almost 10 years from the time we had our situation analysis to the time the policy was developed on antimicrobial resistance. So that means a lot of conversations happened, a lot of opportunities presented themselves, and that meant that I had to be prepared. And not just myself, but there are people who were in very critical positions that helped to shape this conversation. Some of them were in the pharmacy department then, others were in standards, and we just tried to make use of every available opportunity. And I say this so that once you go out, you have an open mind and know that your opportunities can actually be able to come out from multiple places. I had to begin to understand the landscape of policy making. How do you set an agenda? How do you formulate a policy? How do you make decisions? And how do you implement this at the end of the day? A lot of learning and a lot of unlearning. I had to do courses like compassionate leadership to understand myself better, because as a leader, then if you don't understand yourself better, it's very difficult to accommodate multiple voices, and also to build resilience in global health. And I took a lot of time to reflect on actions and reflect on decisions and decide on what would it cost me if I did nothing versus doing something. We didn't have a budget for the program. We were at zero, but we got good partners that supported us, that hosted us. The UoN School of Pharmacy played a key role. The Kenyatta National Hospital Pharmacy Department also played a very key role. And I learned how to communicate and pitch my agenda very early. And what happened ultimately, we were able to establish a whole patient safety division within the Ministry of Health, which was not there before. And I headed this division before I left for the EXA Health community. And the division, because of strategy, we were able to have 3 independent programs that were established: the IPC program, the AMR program, and the patient safety program. And you can see in subsequent photos, we were able to develop a policy and an action plan, and we were able to get the highest levels of leadership at that point to support the agenda, to speak to agenda. And it is so important to be able to get to this point. And you can see the documents that have been generated through the leadership at the division at that level, and the amount of work that has been done over the last 5 to 7 years has been enormous. A lot of contribution to this work has been done by pharmacists, and I keep saying the contribution we have made to building this program is enormous. And within the region, actually, the UoN School of Pharmacy has actually been the first training institution to really integrate antimicrobial stewardship into pre-service training, which is an achievement that many countries have not been able to get to up to this particular point. And we didn't stop at the national level. We were deliberate in establishing the county antimicrobial stewardship interagency committees. And when we sent out the terms of reference, we had thought about it with my colleagues who are pharmacists in the division, and we made sure that within the terms of reference, we made sure that the focal person being appointed was actually a pharmacist. And I put this deliberately here because many times we have opportunities to make decisions, and how we take these opportunities and what we do with them can affect so many lives. So if you're in a position to improve the visibility of colleagues within the profession, I think it's something that we cannot pass. And I can say up to now, half the counties in the countries have CASICs that are actually being led by pharmacists. So we were able also to build a surveillance system. And you can see, like in 2017, when we didn't have any AMR program, we only had 2 pilot sites. But by the end of 2022, we had 28 sites, not just in human health, but in animal health. And what that means for us now as a country is that we have data which we didn't have 5 or 10 years ago. But now we can go into the hospitals that are reporting data. We can describe what we are using as a country. And I think this trend, if it continues into more hospitals, then we will stand better ground. That has taken a lot of advocacy, engaging leaders. And I want to thank leaders like Dr. Rashid that were in very important policy and decision-making positions within government. They embraced our agenda, and they moved it to the highest level possible. And we didn't stop at that. We engaged with farmers. We went across all sectors, and the students have been a central role in the awareness and advocacy efforts within the country. So we had this One Health Students Club, and we appreciated the students when we had our AMR Awareness Week. So it didn't stop at that. We've been engaging the media as well. And one of the things we did with a colleague from agriculture was a document, or put together a documentary that talked about antimicrobial resistance. And this documentary has actually won regional awards for 2 consecutive years during the World Antimicrobial Awareness Week, and also won annual Journalism Excellence Awards within the country. So whatever you do, make sure it is visible and include as many stakeholders as possible, because you just don't know what that information will do for the next person. And the impact has not just been at a national level. I have continued to contribute to the regional and global level, leading some WHO guidance development on documents like the integrated antimicrobial stewardship activities. And because of the good work that the country was doing, Kenya chaired the development of the regional guidance for the establishment of stewardship programs. This is the 2nd edition that was done when I was at EXA, but the first edition in 2017, I was still the MR focal point, and we still chaired the technical working group that has done this work. And that work has gone on to support many other countries to put together their stewardship programs, and this continues to grow over the years. And it's not just ending at the technical level, but also influencing health minister conversations, priority and agenda setting at the regional level. And we continue to bring communities together, communities of people with the same vision and the same intention. So as I wind up my minutes, what are the critical things I've learned in this journey? The first important P is people. It's all about people. We need to get aligned and organized. And when you respect people and you have people at the heart of everything that you do, your passion will fuel progress, because it's being driven by personal conviction. And it's about building trust. I have learned you can have so much technical knowledge, but people skills are so critical in this journey of setting an agenda. You need to build trust. You also need to empower your teams and create space for people to work. And I think over the years that I've been in this program, we've empowered so many people, and I was able to create space, and that's why I was able to really seamlessly move from the Ministry of Health as being focal point, and I handed this over to a team that has even done more than what we were able to do while I was there in leadership. When it comes to policy, simplification is important. Communication in a simple and very clear manner, the place of diplomacy, collaboration. It can never be just about us. We can never do anything alone in a way that's effective. I have learned to embrace all sectors. I've learned to embrace everybody. And we've seen big wins, because when the people and the disciplines work together, then you have a better win at the end of the day. And as we speak now, we're actually developing an integrated pre-service curriculum guide that will help us try and shape the One Health agenda right from the pre-service level. And the process, again, patience and persistence pay off. It takes time. I say it from 2009 to 2017. If we were to give up along the way because doors were not opened when we knocked, or people rubbished what you were doing, because that happened many times when we sacrificed our own resources, I think the process has taught us that we need to be patient. We need to be persistent and resilient. And also we need to stay committed even when the progress feels slow, especially when it's multiple sectors. And finally, empower others to carry the torch. Once you leave, what are you leaving behind? Will what you have built go with you? I think that's one of the questions that I have asked myself so many times. And I learned very early in my journey that the goal for what I do, wherever I am, is really not about personal recognition, but creating a system and a network of champions for the future. And I think that's what we've been able to do. I brought my whole self into public service when I decided to stay. And I realized when I have mentors, they make a big difference. And that we needed to have visionary leadership with persistency and collaboration. And as I close my session, I just want to acknowledge all the colleagues across the sectors. The colleagues in pharmacy have been a real fallback position for me. Every time I've needed to move a step higher, I have consulted widely. I cannot name all of you because you know yourselves, we've interacted very closely with the school in building this. They have sat through our national antimicrobial stewardship interagency committees with no remuneration, but they have built the agenda. And I also learned that when you build a tree or when you plant a seed, I don't expect to sit under the shade. And I think that's what we are doing now. Just do what you need to do in a good way. And when the shade grows, many more people are going to benefit. And the system actually stands a better chance of being better. Thank you. And over to you, Rebecca. And I thank you for the opportunity to speak and the honor of inviting me as well to the symposium. Thank you.
Thank you, Dr. Wesangula. Can we give her another round of applause? When we talk about excellence, isn't excellence? Isn't that excellence? When we are celebrating 50 years, we truly have something to celebrate. From turning a conversation that was at the local level that people were not taken seriously, to creating a whole unit in the Ministry of Health, to creating a unit that was not there before. That is our whole journey. And from what I'm learning from her is you need to be very patient. You need to be very resilient so that at the end of the day, you see what that is going to bring about. But most importantly, work with people, work alone, because this vision is not for you to carry. We are talking about making something a global agenda. So in that, as you grow, you also need to empower other people to walk that journey with you. So to continue with that conversation, I have a distinguished panel that I'll want to invite on stage. So I'm joined by, we'll start with Dr. Charles Githinji, the chair, Pharmacy and Poisons Board. We also have Dr. Frederick Ouma, the acting director, Public Health Research and Informatics, Kenya National Public Health Institute. We also have from Makueni County, Dr. Eric Chomba, Director, Planning and Administration. I'm also joined by our Deputy Director General, Dr. Sultani Matendechero, and also the Acting Director, NQCL, is online. Dr. Matendechero. He'll join us online. And Dr. Anastasia Nyalita, she's a CEC member, Nairobi City County. Not sure whether she's made time to join. I know she was in another call because of the time. She was available at 2, but I'm not sure whether she'll be able to join. So, but without further ado, we'll just want to progress with this conversation about the impact of UoN-trained pharmacists in the public sector. One lady and 3 gentlemen. I don't know whether you can assist us with that, but can you move that one? So welcome to this panel discussion. It's going to be a conversation. I know time is not on our side, but we'll try our best to keep the time. And at this particular time, I want to start with Dr. Charles Githinji. He's the chair of the Pharmacy and Poisons Board. And I want to ask, because of time, you'll allow me to put 2 or 3 questions in one, and then you can just answer them together. The Pharmacy and Poisons Board is often seen as the traffic police of healthcare. Sometimes setting rules, but sometimes rarely praised. So what's one PPB regulation or decision in your tenure that has seemed small at the moment, but had a massive ripple effect on the Kenyan health system? Again, we know PPB is doing a lot, and we want to appreciate you for the effort since you were appointed chair. What is the next frontier for PPB? I'm thinking Africa harmonization, but perhaps you can even expound on that. And then reflecting on your journey, I know you've also served as a CEC at the county level. So this is Dr. Githinji has spanned both from the county level, at the national level, and now at the Pharmacy and Poisons Board. reflecting on your journey from UoN to PPB. What has been the journey like, and what have you learned? And just a legacy question: what will you want to be remembered for, even in your journey in PBA? We know we are doing a lot, but what's the one thing that you'll want to stand out for you? I know I've packed it, but I always say just make it short and sweet.
How long? How many minutes?
We can give you 5.
5 might not be enough, but I'll try. Thank you very much. Good afternoon, ladies and gentlemen. Yeah, well said. Dr. Charles Gedua Gedenji, BFAM 1999. Those are very loaded questions, but the one that caught my attention is when you said we are like what? Police. Traffic police. You know, traffic police.
Seen by the public. Yes.
There's known with 2 things. They stop vehicles, they ask for money, or they make sure the pro is there. I don't know which is which, but I will answer my best. I happen to be, if you really ask me, who is Dr. Gedenji, who are you? That's the most difficult question to me. But I'm a pharmacist by profession, a medical physiologist, and a senior lecturer at the University of Nairobi. I've been a CEC, I've been in private sector, community pharmacy, and have hospitals. I started pharmacies and still going on. I've been a CEC, the first county government when it came to 2013, 2017, and the then now late Governor Diritu Gachagua came back teaching. In 2023, January, got an appointment by the president to be the chair of the St. Poisons Board. So I've worked for the government, I've worked with the government, and I've worked in the government. So I have a big spectrum. So you're asking me is, I would ask for the first, why, first of all, do we need to have government? Why do we invite government in our lives? Somebody talked about inefficiencies as a cause of failure in health, inefficiencies, and also, of course, the funding. Ideally, in ideal situation, we all strive for happiness. And if you are to get everything that you want at the right time, the right price, the right quantity, then we believe in utopian kind of ideal life. But we live in real world. In real world, things do not work like that. We don't get whatever we want at the right time, right quality, right quantity, right price, you know. For that reason, we don't have a perfectly competitive market. We say economy market fails. That's the reason why we invite government in our life to correct the market, to correct inefficiencies. All right? So the hallmark of a government that is working is to overcome inefficiencies. And we see there's a term, those who've done economy say, total efficiency. You cannot do things good without having money. That level of efficiency is not a stage. And that should be the work of the government. And government is a social contract for people. The social contract is a constitution. When we put government in the office, we expect it to do services, good and services to us. It will not. And because of that, give it tools. One of it is policy. The other one is expenditure. And the other one is taxation. Now, PPB falls under the two code policy. And this policy are different types. Ours is regulatory. listen. And a regulator, the long arm of the government. Msikia kama mkono mrefu wa serikali ni sisi. Ule mkono mrefu wa serikali are actually the regulators. And if the government is to fail, first of all, look at the failure in the regulators. If there have to be substandard drugs in the market, is because PPB has slept on his work. All right? And therefore, as a regulator, I have been the chairman and the head of that institution. I've been there for 2 years. This is my 6th month. So I will not talk too much, but there's a few things that I mentioned. One thing is, when I got appointed, I was given instruction. I'm an appointee. So my appointing authority, the thing that he expects, because his vision, and that's His Excellency the President. And one of it was go and sort out governance issues. So one thing is governance issues. For those who have worked closely at PPB, there has been serious changes, movements, changes, real changes, efficient in delivering the unit, from ensuring that HPT are safe, they are safe, they are efficacious, that's some of it, and we need professionals. I would say that that extent, our best within the limited resources to ensure that. For example, on budget, removed some of the expenses that were not removed, the discretionary expenses, and the resources to where it matters most. Like those years for those who are in the industry that used to take 3-4 years, they can tell you the years have reduced. Right now, for the last 3-4 months, we have recruited staff members on contract, train them to work on dossiers for drug registration with the intention to lower the timing from 2-3 years to bring it to below 1 year. All right? Service delivery efficiency. Now, one more, I think I need to mention very quickly. Those who've been in the industry for long, they know this errant professionals. Yes, they are trained, but they become errant. And the need to bring back to the fold with love, not in a punitive way, but with love. I led the board to bring back what we call the EDC. EDC stands for what? This is the Inquiry and Disciplinary Committee, EDC. And it got very expressive instruction that as many cases are brought to us by the inspectors outside there, for those who belong to the fold of pharmacy, we must deal with them in a manner of bringing to the fold with love. But for those who are quacks, we must deal with them obviously. Okay. And that's a decision that now is starting to yield fruit outside if you go to the community pharmacy. You asked about the moving forward, what we see, the future. The future of pharmacy and the PPB, to be specific, is bright from where I start. In that, I always think about other jurisdictions and the authorities that oversee the regulation of health products and technologies. And fascinated by US FDA. PPB is equivalent to USFDA, Food and Drug Authority. And the bill that is in Senate now, you may not agree with me, but I am of the opinion that we need to separate regulation of health products and technology from that of pharmacy practice. To have a Health Product Technology Act or KDA, Kenya Drug Authority, or Kenya Drug and Food Authority, whatever you want to call it, and Pharmacy Council. We separate both. That's the start point. And thank God that is going on. And hopefully, being all that is called health products, including those products that are veterinary products that were held off some years back, politically so, back to the fold, including food and food supplements, herbs and herbal medicine together. That's what we are working on. That's my vision. And so that, again, I think 5 minutes are only. Sometimes this session you call us, please call us few, so that we have time to talk much, to give you to what is there for us. Finally, the legacy. The legacy that I want to be remembered with is that when Dr. Gedeji was the chair of PPB, he brought about a change in governance and removed what we call discretionary powers. There's nothing as bad as abused as discretionary powers. And there are quite a number of instances in our law, Cap 244, that give a lot of discretionary powers to authorities. And that were abusing states. Number two, and how do you do that? Guidelines, putting guidelines in place, gazetting them. Number two, I'm passionate about decimating quacks. Decimating quacks. Meaning, even if it is not 100%, they are left in decimal places. All right? Decimal places. And we have a plan, and I may not elaborate so much about it, but have you ever seen a vehicle in Kenya without a number plate? We start there. If you drive a vehicle in our road without a number plate, what will happen next? The police you talked about will stop you and will ask you where is the number plate, and you have a hard time. This is a time to think about how to identify facilities that are regulated by giving them number plates that are unique, with unique identifier plates, with a lot of security features that can define you, including GPS of where you are and who is there, is he qualified, so that now after public publicity that is going to follow, members of public will start asking you, why are you operating without a number plate? Because we need to overcome the issue of shortage of manpower.
Thank you so much, Dr. Givenju. He sits at the hot seat, yeah? So some of these things I know he's speaking, but they are not easy. You make decisions and they are fought, and it's not easy. So we really appreciate you. And from what I'm hearing from you is that we need to rethink. One of the things that you've mentioned is one of the pain points we've had. Why does it take so long to just register a dossier? And those are some of the things that have not even attracted investment in local manufacturing in Kenya. So I'm happy that you're tackling that one. I'm happy that you're also saying that the pharmacy practice, we also need to rethink even the way it is packaged, even when we look at the regulatory framework and the governance structures. I'm happy that you are doing that. And we wish you all the best. We will pray for you. We know it is not an easy job, but we know that is what we are made of. University of Nairobi Pharmacists are hardcore. We push through even when even it seems hard, because at the end of the day, we are excellent. So we appreciate you, and we'll come back to you. I have a roundup question to you. So right now, I'm seeing the mic is with Dr. Frederick Oma. And what I want to, he sits at the Kenya National Public Health Institute. This is relatively a very new institute. For those who follow the news, it was launched officially just barely a month ago. So we want to understand your journey. There are students here and they are wondering, how do you get there? How do you get there? What has your journey been like? You know, you're building Kenya's public health research backbone from scratch. We've not been dealing a lot on public health research, so you're entering uncharted waters. How did you end up there? And what is the vision? And how can we help you? Because at the end of the day, we need to support you to achieve the greater agenda.
Yeah, thank you. Yes, those are quite some questions, yeah. I may not have very wise words and package my message so well as my senior, the chair of PPB. He started with very wise saying, but I may not be as wise yet. So I'll just tell you stories with very big English to appear very smart. Now, I started off from where Dr. Evelyn Wesangula started, Jaramogi Hospital. That's where I got posted after internship, and shortly after taken to be a sub-county pharmacist. After around 2019. 2019, I attended some few trainings that changed my perspective. Of course, being a sub-county pharmacist, you see things from a different perspective. You are not just responsible for a particular hospital. You don't necessarily do clinical work, but you do more of public health matters. You look at pharmacy from a public health perspective. And of course, there's a supply chain bit. So I got an inspiration to just pursue public health rather than go the clinical way, much to the disappointment of my mentors, one of whom is listening to us online right now. They thought I was good with the clinical matters. But then I enrolled for, or rather I applied for a master's training program called Field Epidemiology and Laboratory Training Program, or FELTEP. Those who have heard about it, it's a government and USCDC sponsored training program, full scholarship, of course, very competitive. But by God's grace, I was able to get there. They were ordinarily not admitting pharmacists in that program because they don't see how a pharmacist can be an epidemiologist, going to the field to look at diseases, investigating, responding, and all that. They are not seeing us as such. They were seeing us as people who are managing stores. So ours was just to supply drugs. Again, by God's grace, I think I managed to achieve a few things in the course of the first year. And after that, they realized that pharmacists actually are more versatile than most healthcare workers. You can handle so much, even clinical matters. You can diagnose in the field when they've run out of clinicians. You can do quite some good diagnosis and treat where there's a crisis during disease outbreaks, for example. And COVID-19 provided a great platform for that when it struck and we were, able to helter-skelter. Nobody knew exactly what to do, and we made quite a number of mistakes, but also achieved quite a lot in the process of that. But as we proceeded with the training, then the FELTEP program managed to now start admitting more pharmacists. The next year, they actually admitted 3 pharmacists. I was happy to see one of them appointed in the SHA task force that was formed the other day. There are quite a number of others that were admitting the program after that. Now, the Field Epidemiology program is largely about disease outbreaks, investigating them and responding to them and containing those kind of situations. I managed to complete the training sometime in early 2022. And then before I actually went back to my initial employer, which was Kisumu County, that had been seconded to during the devolution, the then director for public health looked for a pharmacist who had trained in field epidemiology that could help set up what she was calling national strategic stockpiles in the NPHI. So the National Public Health Institute was, the discussions to form it was there back then. It had been gazetted in early 2022, January, but then the process of actually forming it was taking a bit of time. So as the Director of Public Health, she was tasked to make sure that it was actually operationalized. So at that time, she found that I was the only one who had graduated from that program as a pharmacist. And so she asked me to join her, initially more of as a PA, personal assistant. But then out of respect, she said she would not ask me to carry a handbag and manage a calendar, which was very kind of her. Instead, I was doing more of the technical work and of course the office work, paperwork and the documentation, while also developing a strategy for formulating that national strategic stockpile, which is basically an emergency supply chain system. I know we have a supply chain system, we have KEMSA doing a great job, but we don't have something so specific for emergencies to make sure that you can efficiently have HPTs during emergencies like disease outbreaks. And we all remember what happened during COVID with all the PPEs. Quite a number of them expired and all that because of various inefficiencies and a lot of vested interest. So eventually then PHI was operationalized, and I was brought in to do that. And of course, the whole process of transition from the county, which is quite a headache. But my role there was initially to do the pharmacy bit. But with time, the current acting Director General for the National Public Health Institute saw that I was more research focused, because within 3 years, I'd managed to publish 23 peer-reviewed articles in journals. So with that, she decided to post me to the research side, and of course the board also reviewed and saw it fit that I would be there as a acting that capacity. Now, I think there is great potential for pharmacists in research, particularly because we are more versatile than we think. Pharmacists, as you heard from Dr. Wesangula, she has done so much in AMR and IPC. Now, pharmacists have great opportunities, not just in AMR and IPC. There is a research bit, but also there are various things, supply chain, as usual, but also in disease surveillance and emergency response. When we used to go out to the field during our training, they realized that a pharmacist can do so much more, that having one pharmacist in the team could be equivalent to having 3 or 4 other cadres combined together. So that gives us a serious advantage that I think we need to really utilize. And even for the upcoming pharmacists, as you are thinking of where to specialize and all that, consider the fields that are not traditionally thought to be for pharmacists.
Thank you so much. Isn't that trailblazing? That's a change maker, right? And there are so many opportunities in public health research and also in other research areas. Pharmacists tend to do very well. Actually, let me speak to Nairobi County. Right now, when you look at our research department, we've just started to activate it. We have 5 members working at the research department. Out of the 5 members, 4 are pharmacists. So there's a lot of opportunity for pharmacists to go that. But one thing that is from what he's speaking to our students, I don't know why I'm more encouraged to lean on to the students. Opportunity meets preparedness. When they were looking for someone, when they were starting someone, they were very specific. So had he not done what he had done, he'll not have gotten that opportunity. Secondly, knock the doors. Even when people tell you to stop, knock. Even for Dr. Wesangula, when she was going to do public health, she was told, no, that is a field for, not a field for pharmacy. Who said? Continue knocking, continue persisting. He had the same challenge. I was actually speaking to one of our seniors the other day, our chief officer in Nairobi, and she was telling them, at a time when you go to Ministry of Health and you say you want to do public health, they'll tell you, no, that is not a pharmacist's work. Your work is where? On the counter. But we are changing that slowly by slowly. So allow me now to go to the counties. And with me here is Dr. Eric Chombo. Now, I want to also indulge you, Kidogo. And I'll add you, because of time, just take 3 minutes at most. So as a pharmacist working in a devolved and undeserved context, what lesson have you drawn about the value of pharmacist leadership in county health system? I know right now you formally head in health products and technology at Makueni County. Right now you are heading planning and administration at Makueni County. What have you seen as the value of having pharmacy leadership in county health systems? And is there any success stories that perhaps from your county? I also know that you sit at the caucus. Any success stories about pharmacy leading in the county health systems? Thank you.
Okay. Thank you. Eric Chomba. county pharmacist, Makueni County, and also the acting director, health planning and administration. Many speakers have spoken about health systems, this platform, and also the versatility of a pharmacist. And I'll give you stories from the county on how that is true. Number one, we all know the building blocks of a health system, and one of it is health products and technologies. When we were doing our internship, and a while back, many years back, a pharmacist was seen as a dispenser. You stay in the pharmacy and dish out medicines to clients. But with the advent of the health products and technologies thinking, health systems thinking, even at the national level, we now have a directorate of HPT. And counties have followed suit. Some have directorates of HPT. Some have HPT units. And most, if not all, of these units or directorates are headed by pharmacists. So what this has done is it has elevated the pharmacist to the leadership table at the county level. So you sit at the table where decisions about budgets are being done. You are able to showcase your capabilities, and your colleagues, be it at the hospital level, at the sub-county level, at the county level, even national level, pick out that you have qualities that can be utilized elsewhere beyond the pharmacy. I'll give you an example of many counties now have oncology units. And the story of how these oncology units have come to being is through clinical pharmacy, specialty of oncology. So when the oncology pharmacists graduate, they go back to the counties. For example, Makueni, they started the unit in a building that was meant to be a pharmacy store. So the pharmacist started seeing clients. He's the one doing the IV lines, the one doing the records. He's the one giving the medication. He's the one doing follow-ups. And through that, currently he has a fully fledged oncology unit in Makueni. And I know several others that have followed suit. I know Kitui has followed suit. And this shows how the pharmacist can be able to bring out their versatility in many things. I'll give you an example of another project that we have in Makueni, the introduction of heat-stable carbetocin. So a project started in Makueni with the assistance of a partner. We rolled out 2 years ago heat-stable carbetocin. We know how useful it is compared to the cold chain issues with oxytocin, and PPH being one of the leading causes of maternal mortalities. For a period of over 2 years, we didn't have maternal mortality attributable to PPH because of heat-stable carbetocin.
That's where you clap your hands, yeah?
And of course, not only because of heat-stable carbetocin, also other interventions. And through that project, we now have an access heat-stable carbetocin in KEMSA, where an ampule is 95 shillings. 95 shillings. So to compare that, the other product, Pabal, in the market is 2,900 shillings, which is not affordable to most clients back in Mashinani where we work. So pharmacists can do much more in health system strengthening, in a holistic approach beyond the pharmacy. And we are seeing pharmacists as directors. We are seeing pharmacists as chief officers. We are seeing pharmacists as CECs. We are seeing pharmacists in research, health financing, all pillars of health systems. We are seeing pharmacists there. And I know this will only get better. The stories that are being shared in this symposium are similar. Someone started alone, implemented something, it grew up, snowballed into something big, and which is now impacting health at the workplace. So yes, pharmacists have a lot of value. And I see that we have a lot of more that we can do. We are not yet there. We need more numbers, and we are pushing for that. And I know that we can do great for the health system in this country.
Thank you so much. Thank you so much. Speaking again to the versatility of the pharmacists and how we are making spaces for ourselves, something that was not there. We are very innovative. So I hope this is truly inspiring. Now, to take us home, I want now someone who is sitting at the front row, someone who is setting the national agenda. So I just want to confirm that we have Dr. Sultani on board. I can see him. He's actually away. Right nowadays, pharmacists are also representing at the global scene. So I know he's finalizing his meetings at the World Health Assembly. Did you know it was happening? And we had a pharmacist representing us, sitting there. So Dr. Matendechero, karibu sana. Yes, so you served as the Deputy Director at the Ministry of Health, Acting Director at NQCL. You've listened to what people are doing at various levels, at the national level, at the county level. And from what I know, you're one of the pioneers, trailblazers of redefining what pharmacists can actually do. If I remember Matendechero, at one point, he was the Secretary General of KMPDU. And do you know the current Secretary General of KMPDU is also a pharmacist? So we are very good even in advocacy. And he left that and he must have inspired someone, and Davji took that. After that, I remember again hearing now he's the head at Ministry of Health, he's heading NTDs. So people were asking, why is a pharmacist heading NTDs? You know. And right now he's the Deputy General Director and also serving at the NQCL. So it seems like you are you are part of the team that has really inspired us. So my question to you is, what do you envision as the role of pharmacists contributing to the broader health agenda? And what steps do you think can be taken to strengthen the presence and credibility of pharmacists within traditional spaces that have been considered traditionally, I want to put it in quotes because that's a lie, as medical spaces. So what do you think can be taken to strengthen and to inspire more pharmacists? Because we are change makers and we need to ensure that we are bringing so many of us in board. So from where you sit, from the front row, what would you tell us? And perhaps even speak to your journey. Thank you.
Thank you very much. I hope you can hear me. In the interest of time, maybe just be very brief. So I'll start maybe by introducing myself, Dr. Sultani Matendechero, double. I had my senior Atebe call himself double alumni. I've never heard of that terminology, so probably I should also assume it. A double alumni of University of Nairobi School of Pharmacy. I graduated in 2005. Went back for my clinical pharmacy, graduated in 2019. After my undergraduate, I went to work in Kakamega, and immediately after my internship, I became the pharmacist in charge of the Provincial General Hospital, deputy medical superintendent, and eventually provincial pharmacist. Then after that, I came for my postgraduate, and during my postgraduate, I served as the program pharmacist at the Neglected Tropical Diseases Program. Eventually rose to the position of head of the Neglected Tropical Diseases Program, which after doing very well, it was merged with the unit, the vector-borne diseases unit, into division of vector-borne and neglected tropical diseases. I became the head. Then during COVID, I was shipped off to the armed forces to undertake a one-year course in national security and strategy. After which, when I came back, I was charged with the responsibility of establishing the National Public Health Institute, where our colleague Fred is now director for research. I was specifically informed that efforts to establish the institute had stalled, so I was asked to, jumpstart the efforts. And within 6 months, I had delivered on gazettement, the Gazette notice that established the institute. Then at the onset of the new government, I was appointed Deputy Director General at the State Department for Public Health and Professional Standards. So that now in the State Department, I am the technical lead in the State Department for Public Health and Professional Standards. One of the portfolios that have come with that is when our NQCL experienced a bit of challenges, I was asked to come in and oversee the transition into stability, which I am now doing. And I'm happy with the progress that the team is putting in at NQCL. Soon, we should be advertising for the positions that we have been able to establish there. Now, outside of my day-to-day work in the ministry, I also sit on the board of one of the leading NGOs in the country, representing the Cabinet Secretary for Health in the board of AMREF. I've also served on the board of Kenya Red Cross Society. Outside of national duty, I've served as the chair of the National Neglected Tropical Diseases Program Managers Community of Practice. Globally, I've also served as I currently serve as an advisor of the Director General of the Africa CDC on matters, public health emergencies on the Emergency Consultative Group. I also serve as the chair of the Policy Advisory Stakeholders Group on epidemic preparedness. Globally, I have served as vice chair of WHO's working group on amendments to the international health regulations. And currently, I also serve on the technical advisory group on soil transmitted helminths and schistosomiasis. So generally, in a nutshell, that's my scope of work. I just wanted to go through it so that I can be able to paint a picture of what a pharmacist can do vis-a-vis what I thought we are supposed to do when I got into service. And this was more than 20 years ago, when the belief was that pharmacists are glorified shopkeepers who should just be behind counters dispensing and dishing out medicines. I have actually taken a lot of that in terms of when I reach out to aspire for some of these responsibilities. You have reminded me of the challenge I had to go through, because when I came into service, there was a division of pharmacy at the Ministry of Health. And the best a pharmacist could become was chief pharmacist. So we had chief pharmacists who would really, do whatever they wanted with us. But then we were very lowly placed, and that was our cap. So one of the things I did, I went to the PS at one point was Dr. Muraguri. And I told him that I don't want to be in that division anymore, because all pharmacists were in the division of, pharmacy. So I said, I don't want that division. So I was moved out of the division of pharmacy and taken to the division of vector-borne diseases when I was in the NTDs. And for the first time, I was able to now grow beyond that division of pharmacy. And at one point, I was actually heading the division of vector-borne and neglected tropical diseases, while the division of pharmacy had now been taken to become a unit under the division of clinical services. So we have made a lot of strides. Of course, behind the scenes, we have done a lot of advocacy. I remember there's a time there was a lot of advocacy towards creating a directorate of pharmaceutical services, which I opposed vehemently. I was castigated for that, but my thinking was that we cannot go back to that bottled kind of approach. And so we have been trying to advocate for pharmacists to take up senior positions. I'm very happy to say that now there are 3 of us at the level of director. We have myself as a Deputy Director General. We have Dr. Tom Menge, my teacher, who is a director of HPTs. We have Dr. Charles Kandie, who we recently appointed as a Director for Health Standards and Quality at the Ministry of Health. So we are doing very well as pharmacists. We have broken the glass ceiling, and we have proved that we are able to serve at any level within the health sector. And of course, one of the things I want to now encourage, especially our younger colleagues, is to encourage you to strive for excellence, to go for the best. Reach out for gold, because we are part and parcel of this health sector. I hope you can still hear me. I can see something on saying webcam utility. I don't know whether you can still hear me. Just confirm.
We can hear you. We can hear you.
Okay, thank you. Yeah, so I just wanted to maybe use that as just to say a few things about what we need to do. Pharmacy being part and parcel of the public health system actually now gives you the right to do anything you want. I realized that we are the ones who limit ourselves. Actually, nobody out there is interested in limiting you. It is just us who want to wait for things to be given to us. So we need to be proactive, we need to reach out, we need to be aggressive. For if you forget everything else, just remember that you need to be proactive and aggressive and to reach out for what you want. Otherwise, nobody, absolutely nobody, will come and hand it to you on a silver platter. And when you do it, believe you me, we are much better than everyone else. You will get it. I think we just don't have enough confidence in ourselves. But once we do that, then we should be able to get it. You said I was Secretary General of KMPDU. Of course, at that time, it was believed that pharmacists can never be Secretary General, but we actually disapproved that. And today, I'm very proud to see that one of our own is Secretary General after me. Finally, I just want to really encourage that apart from what we have gained in terms of training as pharmacists, it is critical to improve on our capacity. And this is for everyone, including my colleagues, because I've realized that pharmacists are a bit lacking in some of the very important complementary skills, knowledge, and attitudes that we need. And these include leadership and management, monitoring and evaluation. It's good for us to be able to take up in our free time. Let's reach out and invest in ourselves. Personally, apart from the National Security and Strategy course, I have also undertaken, I'm about to finish my master's in arts in international studies. I'm hoping that very soon I might now move and become an ambassador or something so that we can change what we are doing. Maybe in a country that produces, like India, produces a lot of pharmaceuticals. I think we can diversify even more. I'm currently pursuing a PhD in global health, and it really talks to what we are doing. Actually, I've now come to Madrid. We are now having a global health conference this evening just to discuss about some of these trends. But what we need to now really make sure is whatever you do, whatever it is, where you find yourself, give it your best. Because when you give your best and you excel, you are seen. And whatever you achieve, speak about it. I'm very happy to hear that my younger colleague, Fred, has published 26 papers. That is one of the ways in which you broadcast what you are doing. We are not good at letting the world know the great things that we are doing as pharmacists. So let's do it. Let us publish. Let us attend conferences. Let's tell people about what we are doing, and we will keep on growing. In the interest of time, I want to stop at that point and to really thank the organizers of this symposium. This is a brilliant idea, bringing colleagues together so that we can share best practices, talk about our challenges, and learn from each other. Thank you very much, and back to you, moderator.
Thank you so much. That was very, very, very inspiring. And what is he saying? That let's not limit ourselves. Let's go for it. If we can do it, we can also do it, right? Yes. I and actually I want to read a quote at this point. It says, if your actions inspire others to dream more, to learn more, to do more, and become more, then you are a leader. And I think that is what exactly Dr. Matende Chero has done for us. He's inspired a lot of us to know that we can actually break these barriers, and we're actually shattering those glass ceilings. In absentia, Dr. Nyalita is one of our series, but she's not available here. But that is the other person who's shown us that you can be anything. She started as our CEC as health, and right now she's our CEC of business and hustle opportunities. You can do anything. And she sits at the cabinet of Nairobi, making very strategic decisions, shaping policy for Nairobians. So you go with it. There's nowhere that we cannot flourish. And in the spirit of saying that if you can inspire others, if you can do others, I just want to speak for Dr. Nyalita, what she has done for me. When she came to the Nairobi County, she was coming from the private sector, and she was one of my bosses. Actually, she just held my hand. And out of there, a lot of it was only 6 months. She held my hand for 6 months, but she was not literally teaching me. I could just see. And that is the best way of learning. You just see and you like, I can actually do more. And one of the things that I did is I created my own department, health financing. It was not there in Nairobi County. And I actually didn't create it. One of my bosses, who is the chief officer of public health, looked at me and the work I was doing and thought I was doing partnerships, some strategic partnerships for Nairobi County, something that even a pharmacist doesn't do. I was like, hey, with this, with our limited fiscal budget, we need to explore and see how we can attract partners to work with us. And not just the NGOs, also foundations and all that. So I was just doing partnerships. Then he said, no, we want you to look at the whole thing, the external and the internal. So why don't we head health financing? And it was just a conversation. Then the next day I just saw a post in order, Dr. Rebecca Musyoki, head of health financing, something that I had not even asked for. So sometimes it will be given for you because of your proactiveness. You've not even asked for it and someone gives. And one of the things that I noted is the perception. When you hear Nairobi County, what comes to your mind? You see, I realized that there is need to change perception so that we can even be able to attract partners. And another thing I looked at, the opportunity that we have not seized as in terms of raising resources was research. As a county, I felt that we've not optimized on that. And one of the ways, even the university, one of the ways that they make alternative, they diversify their sources of income is through research grants. So one of the platforms that we created, led by our chief officer of medical services now, who is also a pharmacist, is we created a platform, the first Nairobi Health Scientific Conference. And I was the co-chair, the first co-chair. So that was our brainchild. And we said, we are going to do it, and we are going to do it so excellently that everyone will want to work with us. So we did it last year. We had over 700 delegates. It was at the Ole Sereni. The deputy president came to open it, and they were like, wow, who did this? Who did you hire? And we were like, it is just us. We didn't sleep. We just wanted to make it happen. We knocked on so many partners, telling them, come partner with us, but they were like, this is Nairobi County. This is the first time. You know, we didn't even have a proof of concept, but we were relentless. We were relentless, and we got partners. And the partners that came on the ground were telling me, one of the big partners that we actually attracted was Roche. When they came on the ground, they were like, we were not so sure, but when they came to the ground, their own Africa vice president told me, that is Dr. Alan Pamba, this is good. Even the content is good. You guys have done well. So what happened? We start changing our narrative, and they're like, right now we are exploring how to work beyond the conference, how we can now work with them for more. So that is what I'm trying to tell you, that you can redefine, just be persistent, continue, and make your priorities an agenda. And people will be welcome. They'll start seeing that and say, Rebecca, take this one, take this one. So in a wrap up, we are going to do a lightning shot, if you'll allow me. Just one question that everyone will answer in 30 seconds with your closing remarks. We are all public servants. Don't we look nice, by the way? What do you think? I hope the cameraman has taken a photo. One of the things he said is we need to be visible. So I hope you've taken a photo on this, because we are going to post on our LinkedIn and say we are having conversations as University of Nairobi pharmacy. So I hope you've taken a photo. We look very good. So just a lightning question, a fun fact. I want everyone to answer the same question. The biggest myth about pharmacists in government is, and now you are debunking, what do they think about us? What do they say about us? You can start with Daktari as you wrap up.
Okay. Again, the question?
the biggest myth about pharmacists in government is?
Okay.
What do you just finish the lesson?
You know, when you get to a golden age,
Mm.
sometimes you forget quickly. I think in government or public, basically,
public service, in public service.
basically what Moderator said, glorified shopkeepers, they are dispensers, you know, like a machine.
Mm. How are you debugging that?
Being a thinker and implementer, they said if you pick 100 people, only 5% are thinking. The others are just repeating routines. And out of those 5, 4 are thinking that they are thinking. And so it's only one who is actually thinking. So I like taking time to think, and whatever I think, I write down as if it's a program, it's a solution to a problem, and I share. Thank you.
I like that. So he's the thinker among the 10. So they think we are just glorified, but for him, how he's debunking that, he's the thinker, and those are the people we need.
Same question.
The biggest myth people have about pharmacists in government or in public service.
Forget it's not just about golden age. Sometimes it's the tension on this stage. But let me first of all, before I answer the question, acknowledge my senior, Dr. Matende Chero. I was listening to the committees that he sits in, and he did not mention all of them. I think he summarized. There's also one we serving together, the National Psychiatrist Elimination Committee, and several others. I think he's doing quite a lot of work, and I really look up to him. But on that question, I think one of the biggest misconceptions that pharmacies are watu wa madawa in the sense of supply chain. People see us as conduits. Pitisha dawa from the supplier to the patient. I don't think that is what we do, and it's something that we have to change. We have to change the perception that a pharmacist has to sit behind some grills like an inmate. Across the grills. We have to change that perception and be more intentional what we do. I really admire the work being done by various pharmacists, the clinical fields, and so many other areas. Personally, I chose the public health sector because I believe in public health, I can make much greater impact to more people based on my passion than just dispensing and doing the traditional roles that pharmacists have been said to. So my strategy is to get the work done, do the research. Some of the research is really public health research, observing what is going on and seeing what we can do to intervene in those situations, particularly related to public health emergencies. Doing as much as possible and disseminating it as much as possible. And some of these cases are you face some fight along the way, but you persist. Just never give up. Keep going at it.
In a minute.
Okay, so I think the biggest myth is the pharmacists belong in the pharmacy. The greatest way we are debunking it is that many people in public service and elsewhere just look at the problem and discuss the problem and think of solutions, but never implement them. Never implement anything. They never do anything. They just talk about it and it ends there. But pharmacists, time and again, I know many of them in my county and beyond, are actually the people who get it done. They are the doers. They are the implementers of the solutions. And many times when there's a burning issue in the counties or elsewhere in the public space, there's the temptation. You know, once you prove that you can do something, the job doesn't end. They see that you can do more jobs. So you're given more titles, you're given more opportunities since you are a doer. And I think that's how we are debunking the myth that we belong to the pharmacy window and our work is just to dispense.
I'm not sure whether Dr. Moderator is on the call.
Yeah, I'm here.
Do you want to take that one in 30 seconds? The biggest.
Yeah, just to first of all to clarify that dispensing is not a derogatory role. It is a very, very important role. I think we have to be proud of dispensing as our core mandate, but then we should not just focus there alone. I think it's important for us to think of other areas where we can function well. Now, the biggest myth, I think for me, I'll give two. Number one, people think that pharmacists are not managers. I think that is something that we can be able to correct by, as I said, introducing leadership and management courses, even within our curricula in the university, so that we can shape. Pharmacy is a difficult course, so we really need to enable our future generations of pharmacists to be able to inculcate management, even from the training perspective. Number two, there is a thing that is said that pharmacists want to be paid for reading and not working. So because we think that we read a lot and we performed well in school, so we want to be paid a lot of money for doing nothing. I think that one we also need to really work towards being able to show value, so that people don't think that we are just sitting there and earning money for nothing. We really need to do much more so that we can show value. I think inculcating clinical pharmacy work into our work is also an area that is really showcasing what value we can be able to bring. And then there was always this thinking that pharmacists are not public health practitioners, but that one we have demolished it. Right now, we are leading the public health portfolio, not just domestically, but even internationally. So I think it is something that I would encourage colleagues also to venture into. But whatever the case, let's keep marching on. Thank you.
Thank you. As a moderator, I have mine, and I think Dr. Moderator actually read my mind, that we cannot lead, that we are not managers. How am I debunking it? You learn. Dr. Wesangula says that you have to keep learning, and one of the things she had to learn is compassionate leadership. I think one of our shortfalls is we are go-getters. We are like most of pharmacists have come to see our type A personalities. You just go, and sometimes in leading, you have to learn how to bring people together. So one of the things I'm also learning is compassionate leadership. I had to go to school so that first I have the papers, and then I tell them, what are you saying? I can actually lead. So with that, I want to wrap up the end of this session. I'm sure by the time is our enemy here. The Q&A, I'm sure, will have been very amazing. I doubt we have provision for Q&A. Do we have provision?
Sorry, I think you have finished your time. Thank you very much, Dr.
Okay, so let me just wrap.
Thank you, Dr. Musyoki.
Yes. So allow me to wrap it up. We'll not have a Q&A. So I'll just like to read the closing. So thank you, Dr. Wesangula, for the initial foundational presentation. And a huge thank you to our esteemed panelists. I couldn't have done this without you. For the gentlemen, it was me and the gentlemen. I appreciate you, Dr. Sultani Matentechero, Dr. Charles Githinji, Dr. Frederick Ouma, and Dr. Eric Chomba for sharing your invaluable experiences and insights. And thank you, the audience, for your engaging questions and not questions. Didn't have that. For your engaging participation and just drawing into this conversation. So as we draw this conversation to a close, the overarching theme is that UoN-trained pharmacists are not just custodians of medicines. We are also architects of health systems and change makers in public service. We've heard how we have influenced transformation in healthcare at the county level, Health Research Institute, and the need for continued influence in spaces traditionally not considered within our domain. So the stories and the lessons shared today serve as a powerful call to action. Let the legacy celebrated here today inspire even greater contributions by you tomorrow, right? We are just making the path, but you're going to do a greater job. So on behalf of the organizers of the University of Nairobi, and everyone that has taken part of you, allow me to just say, asanteni sana. Thank you.
Thank you, Dr. Musyoki, and sincere appreciation to all our panelists for such a compelling and insightful discussion. What we've just heard is a testimony as to how our profession has advanced in public service. We now see pharmacists influencing policy, safeguarding regulatory systems, and delivering public health leadership at the highest levels. These milestones were once unthinkable, but they have become our lived reality. Allow me just to make brief remarks and thank specifically what stood out. Dr. Evelyn Wesangula is building the table. She's not looking for a seat at the table. Please get me clear. Dr. Evelyn Wesangula has not been looking for a seat at the table. She has been building the table. From the New Nyanza General Hospital, she wrote her own job description. Have that clear. She created antimicrobial stewardship agenda at the Ministry of Health. She blended policy acumen with compassionate leadership. You see, now she can talk about establishing systems. When I asked all pharmacists about whether we are able to go beyond the caps, only one pharmacist responded in the affirmative, Dr. Sultani Matendechero. And I'm happy that he has really been a trailblazer in everything. From Western Kenya to global arena. He has broken the barriers, the false ceilings that we set for ourselves. He has been very busy building tables, not waiting for a seat, building tables, creating opportunities for pharmacists, trailblazing. At least, Dr. Matendechero, Dr. Evelyn Wesangula, if I get opportunity for you to speak anywhere, you will be the first there. Thank you very much.